In this video, I will be discussing binge eating disorders. I will explore the topics such as classifications and symptoms, the neurological impacts, and the treatments that are currently available to combat such disorder. Binge eating disorder is defined as frequently consuming unusual large amount of food in one sitting and feeling that eating behavior is out of control. According to the Diagnostic Statistical Manual of Mental Disorders, the 5th edition, BED is defined by certain criteria. First, individuals should report eating an abnormal large amount of food in a short duration. This also means that a person suffering from BED has to consume food at a fast rate, be sickly full, consume large food when they are not even hungry, eat alone to avoid feeling embarrassment, or feel depressed, disgusted, or guilty after eating. Secondly, a person has had to follow this behavior for once a week for about 3 months before they can be diagnosed with BED. Recurrent episodes of binge eating are characterized by both of the following. 1. Eating in a discrete period of time and amount of food that is definitely larger than what most people would eat in a similar period of time under similar circumstances. And secondly is a sense of lack of control over eating during the episode, like a feeling that one cannot stop eating or control what or how much you are eating. Through Pavlovian conditioning, goal-oriented voluntary actions can become compulsive behavior. There has also been demonstrations that humans can continue overeating, even when overeating is associated with a negative effect. This element of continued overeating, despite the consequences, is characterized by failure of inhibitory control process, which continue to a loss of control over eating. For eating disorders, there are two main neurotransmitters, serotonin and dopamine. These neurotransmitters have an effect on everyone. It can affect how we think, behave, our personalities, and even how we develop an eating disorder. A variety of studies have demonstrated how those with eating disorders have alterations in the serotonin system. These individuals have significantly lower levels of serotonin and dopamine. Researchers believe that individuals with BED also suffer from low dopamine levels, which is believed to contribute to binge eating in order to attempt to relieve the depressed mood caused by low dopamine. Dopamine in binge eating disorder has been linked to a hyper-responsiveness to rewards such as food, which makes eating more rewarding and pleasurable than in people without this disorder, and leads to a continuation of compulsive overeating. Those currently suffering from binge eating disorders are able to combat this disease with the help of therapy and antidepressants, which are able to help with serotonin and dopamine levels in the brain. Those with BED might be recommended by a doctor a prescription medication as part of their treatment. Cognitive behavior therapy and counseling are usually the first steps in treating this disorder. Sometimes doctors recommend the combination of medication and therapy. Other times, doctors might prescribe a drug for BED not specifically approved to treat it. These drugs include antidepressants and certain anti-seizure drugs. Antidepressants target brain chemicals in order to help control a person's mood. By boosting a person's mood, it might help against binging. Studies demonstrate that drugs such as tricyclic antidepressants and bupropion have helped, although bupropion can cause seizures if the person takes it, binges, and then purges. Those currently suffering from BED should seek professional help from support groups, patient organizations, or healthcare professionals. If you or anyone you know is currently suffering from binge eating, just know that there are multiple resources available.